Nursing considerations. Educate about home glucose monitoring. Discuss glucose monitoring at home with the patient according to individual parameters to identify and manage glucose variation. It's about educating how to use the pump, how to do injection, and how to check the glucose with the finger stick. Review factors in glucose instability. Review clients' common situations that contribute to glucose instability because there are multiple factors that can play a role at any time, like missing meals, infection, or other illnesses. Infection may lead to raising in blood glucose level, regardless the missing meals. During the infection time, the monitoring has to be done frequently, and any reading above 240 has to be followed by the checking the ketones. Encourage client to read labels. The client must choose foods described as having a low glycemic index, higher fiber, and low fat content. Why low glycemic index? Because the lower the glycemic index, the less spikes in the glucose levels in a short time happen. High fiber and low fat content. Check the ability of insulin. Emphasize the importance of checking expiration dates of medication. Inspecting insulin for cloudiness if it's normally clear. And monitoring proper storage and preparation because this affects insulin absorbability. With the insulin which is going to be expired, it doesn't have the same potency as the fresh insulin. So it means the amount that you usually inject will not have the same effect on lowering the blood sugar than the insulin that is nice and fresh. Review type of insulin used. Note the type of insulin to be administered together with the method of delivery and time of administration. This affects timing of effect and provides clues to potential timing of glucose instability. It depends how the insulin is used. Some people use the pump. The pump is injecting long time insulin, like a little tiny amounts every few minutes, so the insulin is kept on a stable level. Plus, the insulin, fast acting one, is injected through the pump on request before the person eats, counting the carbs and figuring out how many units of insulin has to be added. Check injection sites periodically. Insulin absorption can vary day to day in healthy sites and is less absorbable. The sites have to be checked periodically because the injections, there are like probably around 5 injections a day, as many times as the person is eating, plus the long-acting insulin. So the sites have to be changed frequently, the same as a finger stick checking the blood glucose level. The fingers may get very sore, and the children has to be informed that it's not a comfortable procedure. Very, very important thing that has to be taught by the nurses to the clients is also teaching the family and the patient the management of hypoglycemia and hyperglycemia. As I said before, in the blood glucose, which is higher than 240, the urine might be tested for ketones. It usually happens during the illness where the ketones start to rise with the higher glucose level in the blood. A decrease and hypoglycemia, the risk, or the patient is in high risk of hypoglycemia if the bigger amount of insulin was injected than it was needed, or if the insulin was already injected and the patients skipped a meal. Another reason might be high physical activity. So there are multiple teaching that the nurse is supposed to perform to keep the patients safe.